Yeah, it's Mel from Ultimate OSCE, and this is just a little informal video for you on Facebook and WhatsApp to talk about the implementation station. So your implementation station is the third station of the API section of your OSCE. So in the first station you assess your patient. It will be a live actor then. You then move to the second station where you plan care for your patient. And in the third station, which is the implementation station, you then demonstrate medicine management for that patient. This station looks a lot like this. So your patient has turned into a mannequin. The examiner acts as the voice of the patient. The patient can be in a chair, in a bed. They'll have a little patient table. They'll have some pretend water. You will be told in your scenario that you're to give due medication for, say, 1800 hours, for example, and it's a 15-minute station. So you'll be given your medication chart only when your station starts. You won't get a chance to pre-look at it or anything like that. You'll have a medicine trolley, much like this, with all the medications lined up alphabetically. You will have a little medicine tray, you'll have hand gel, and you'll have a BNF. As I said before, it's a 15-minute station, so they are assessing you, as they do for the third year students in the UK, for the essential skill clusters of medicine management. So medicine management is you should only be giving medication and administering medication when it's appropriate for your patient. So for example, if your patient is due a beta blocker, but your patient has low blood pressure and a low pulse, medicine management is withholding that medication and speaking to the prescriber rather than administering it. We're not meant to just administer medications like trained monkeys. We're meant to be demonstrating to the examiner that we understand every medicine that we're giving, and if we don't, we should refer to the BNF. So this is a book with all the medications in. We shouldn't give a medication if we don't know the correct dose, the correct therapeutic benefits of the drug, and a couple of the side effects, okay? As well as medicine management, we should also be demonstrating the essential skills cluster of infection control. As with all OSCEs, when you've got a live patient or a pretend patient, you need to be demonstrating correct hand hygiene. You should also be demonstrating effective communication. So that's when we check for informed consent, make sure the patient's happy to take the medication, they know what it's about, what the therapeutic benefits are, and what the side effects are. Just one or two, you don't have to name everything. And also, a part of your safe administration of medicine is doing the rights of medication. Okay, so you need to be speaking out loud during this procedure, or thinking out loud as they call it. So you go through the rights of medication, checking all the patient's details out loud to the examiner, and administering the medicines that are appropriate and safe for that patient. And of course, charting correctly at the end. And if a drug is withheld for any reason, coding it correctly and taking the right steps, such as notifying the prescriber. It's basically all part of the drug guidelines that the NMC uses that will be attached below, or I'll give you a copy of, especially Standard 8, that we're meant to demonstrate in this OSCE. Okay, bye for now.